Today on Cancer Buzz, in-track gene fusion testing. Welcome back to Cancer Buzz, the podcast show for the cancer professional. I'm your host, Summer Johnson. This is the third and final episode in our series on in-track gene fusion-positive cancer. Today, technology can improve treatment for these patients and streamline coordination of biomarker testing between patients, providers, and vendors. Our guest joins us today to discuss techniques and tools to help care teams facilitate biomarker testing for patients. Jim Palma is the Executive Director of TargetCancer Foundation in Cambridge, Massachusetts.
So I think that there's a lot of ways that people are tackling this problem, and it is a problem that exists throughout the cancer community. In my organization, we look at this from a rare cancer perspective. That's what our mission is. And it really is one of the biggest challenges that patients with rare cancers face is access to biomarker testing, as well as access to interpretation of results in a way that leads them to the right treatment. So what we've done in our organization is we've developed a clinical trial that offers testing to patients at no cost and eases their ability to enroll in the trial through remote consenting.
Can you tell us a little bit about the TRACK clinical trial and how it helps patients with rare cancers?
Sure. So the TRACK clinical trial was really developed directly in response to the challenges that we were hearing about from patients every day when we worked with them. So the clinical trial is designed to really address and alleviate those challenges and lead patients with rare cancers to appropriate treatments, especially in rare cancers where patients might not have any real treatment options. The trial is fully remote. So there's no need to travel to an enrolling site. Patients enroll from their homes, and it's a patient-driven enrollment. So it's something where patients really take the lead in participating in this research study. We do the work of coordinating the collection of medical records. We send a mobile phlebotomist to their home to take a blood draw, and we also do the work to coordinate getting their tissue from their treating institution and offer testing. And then finally, we coordinate a virtual molecular tumor board, which is a group of about 12 experts from around the country who meet weekly, talk about each patient case, and then provide treatment recommendations back to the patients. So TRACK really has parallel goals. On one hand, it's delivering personalized data to patients in a way that we hope will impact their treatment in a very positive way. And at the same time, it's generating research data in rare cancers that otherwise don't typically have a lot of attention. And in this study so far, we've seen about 38 different types of rare cancers.
How do you get community cancer programs involved?
That's a great question. And really, it gets to the heart of what we're trying to accomplish with the study. Through the remote consenting, we feel like we have a great opportunity here to reach patients who are being treated at community hospitals. Really, our strategy so far has been to recruit for TRACK through our partnerships in the advocacy space. So TargetCancer Foundation is a broad rare cancer organization, but we work very closely and have great friendships and partnerships with many rare cancer specific disease organizations. So we've worked with them directly to recruit patients, but we've also made great clinical relationships at different community centers where maybe a particular clinician or an institution has heard about our trial. They see the opportunity to help the patients that they're working with, and they start sending many of their patients our way. All of that being said, we're always interested in building connections with centers and with networks of centers for anybody who might be interested in partnering with us to make sure that their patients can access this trial.
How does the molecular tumor board support community cancer centers?
I think I've been seeing more and more different types of tumor boards sort of popping up in the landscape, which I think is a great thing because they really can be a great resource to any physician, but especially maybe to again, thinking about rare cancers, a general oncologist who may have never seen the type of rare cancer that they're treating because these cancers are so rare. A patient may only come their way, once or twice in their career, if at all. So the tumor boards can be very beneficial. For TRACK, we're enrolling 400 patients in this study. So really any physician who has a patient who is enrolled in the study has the opportunity, if they would like to join the molecular tumor board meeting, to meet with our physicians, to hear the discussion that they have and the rationale that they come up with for making the recommendations for treatments that they are. Another resource that we provide, again, this is only through our study, is that even if the physician can't make the molecular tumor board meeting, and of course, doctors are very busy, so it's hard to get them to attend those meetings, oftentimes our PIs will make themselves available to them after the fact So if there's a follow-up question or just, a little more explanation needed, they'll take that call. They're very, very generous in that way, because really to them, there's the study, but there's a greater mission here, and that's communicating the importance of testing and molecularly matched therapies.
Thank you to our guest today, and thank you to our listeners for looking to Cancer Buzz to keep you updated on the latest news and fresh takes on trends in cancer care. You can have a look at the show notes for more information on the work TargetCancer Foundation is doing and more resources for biomarker testing coordination. And if you haven't already, don't forget to go back and listen to the previous episodes in this series on in-track gene fusion testing. Today's episode was made possible by funding through Bayer. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.